Hi, and welcome back to ALECTV. I'm Tom McLaughlin, coming to you once again from the States and Nation Policy Summit in Scottsdale, Arizona. I'm joined now by Brian Blase, the president of Blase Policy Strategies and formerly the special assistant to the president at the National Economic Council. How are you doing today?
I'm great. Thanks for having me.
Thanks for being here.
Sure.
So you were one of the president's top guys on healthcare. Is that correct?
Right.
So what was the major focus of the administration's stance on healthcare in the beginning part of their term?
Well, I mean, we tried to work with Congress to provide relief to Americans from Obamacare. Ultimately, Congress wasn't able to provide that relief. So at the end of September, the president was adamant that we take actions to help Americans, and he signed an executive order on promoting healthcare choice and competition across the United States that had sort of 4 specific items that were aimed at helping Americans who had been harmed by Obamacare and fixing healthcare policy to some degree.
Great. I'll come back to that in a minute. But what was your specific purview within that office and within that operation?
So the National Economic Council oversees sort of the coordination of policymaking throughout the executive branch on economic policy. So I worked with the Departments of Health and Human Services, Treasury, IRS, CMS, Labor, and other White House components to form legislative strategy, regulatory strategy, advise the president, and implement administration policy.
That's pretty interesting. Seems like some pretty high-level stuff there.
It was great.
That's really awesome.
Yeah.
So going off of that, you were talking about executive orders. There were 2 big executive orders in the early part of the presidency that were really important to the face of healthcare in the U.S. Can you talk about some of those executive orders?
Sure. So the first one that I mentioned came after repeal and replace fell apart and had 3 regulatory changes. The first was an expansion of association health plans. So small businesses and their employees were particularly hurt by Obamacare. They were less likely to offer coverage and costs were going up. So the administration released a rule that made it easier for small businesses to join together to offer coverage and get some of the regulatory advantages that large employers receive. We did a second regulation, expanding things called short-term limited duration insurance. These are plans that aren't subject to any of Obamacare's rules and regulations, so are much more affordable for people. The Obama administration, in its desire to get everyone into Obamacare plans, restricted these policies at the end of its second term. We opened them up. And if you look at sort of the benefit of the association health plan expansion, the short-term limited duration insurance, and Congress was successful in eliminating the individual mandate penalty, the combination of those 3 actions provides Americans much greater choice of how to finance their health care, and the White House Council of Economic Advisors estimated a $500 billion benefit from those 3 actions over a decade. Yeah, pretty big.
Yeah.
So even though Congress failed, the administration was able to step in and help many of the individuals who had been harmed by Obamacare. We did one further sort of perhaps the most transformative action was a rule that was released in June this year called health reimbursement. It was an expansion of something called health reimbursement arrangements. Most people get their insurance through the workplace. One of the problems with this is that many employers only offer their workers a single choice of coverage. What we did was allow workers to provide tax-free contributions for employees to go pick coverage in the individual market.
Oh, wow.
So the analogy would sort of be like how we transformed pensions from defined benefit pensions to 401ks and 403bs, where the worker's getting the tax-free contribution, and then they're going and picking the coverage that works best for them in the individual market. We actually project that 11 million people within about 5 years are going to buy in the individual market with these HRAs. So just like a cost-benefit analysis with Obamacare's added about 3 million people to the individual market with $50 billion of spending. So about $17,000 per new enrollee. The Trump administration's HRA rule will put 7 to 8 million more people on the individual market with no new federal spending and no mandates.
Nothing like harnessing the power of the free market, huh?
Yep.
That's really cool.
And choice and competition.
Yeah. So the other, now, the other big executive order that you guys did was with price equality transparency. That's correct?
That's right. So that happened in June. The president signed an order to increase price and quality transparency. And sort of the big action that's come out of this is a final rule from the Department of Health and Human Services that hospitals have to post their negotiated rates with insurance companies and also put the rates publicly available and in a sort of consumer-friendly way for 300 shoppable services. In most markets, consumers know prices in advance.
Right.
Healthcare is distorted by an abundance of third-party payment, consolidated markets, a lot of government policies that protect incumbents from competition, and we really feel like price transparency can inject some pro-consumer and competitive forces into the market, which will help consumers and employers in purchasing care and should lead to lower prices and spending over time.
That's really awesome. So for you, what kind of advice, there's a lot of legislators today in the states and at the federal level, but here at ALEC, we like to focus on the states.
Yep.
What does this mean for legislators at the state level?
So there's a lot of actions that states can take to promote choice and competition. So first off, they can produce a conducive environment for the plans that I mentioned, the AHPs and short-term plans. Those are subject to state regulation. Some states, like New York and California, have severely restricted those plans. Other states over the past year have expanded access to those plans. States like Indiana, Oklahoma, North Carolina, and states should allow their consumers maximum choice to finance health care. There's also a lot of state-level regulation that reduces choices for consumers, like narrow scope of practice requirements that restrict like nurse practitioners, certified nurse anesthetists, physician's assistants from practicing to the top of their skill set. There's these things called certificate of need laws, which are very anti-competitive, protect incumbent firms, and actually require new entrants to often go to the incumbents and ask for the permission from the incumbents to enter the markets. Can you think of anything more anti-competitive than that?
Unbelievable. There's just a thing in Michigan about that just about a month and a half ago.
Yeah, we had a victory there.
Yeah, they ended up not doing it, which was pretty interesting.
Yep. So there's a lot of action that states can take to get rid of some of their anti-competitive barriers to competition in their markets.
Yeah, really. Well, Brian, I want to thank you for joining me today
Sure.
and kind of informing me about some of the work that the administration is doing in healthcare and some of the work that you were doing specifically. It's really interesting to learn about this sort of stuff and how state legislators can help us and can help you guys really get that stuff done. Thanks for joining us, and keep it right here for more ALECTV. We'll come back with more coverage very soon.
Thank you.